And, when you come into the office for those dermatology exams, a lot of my patients wear beautiful nail polishes to cover those nails. Probably a good idea to take that off just so we can get a thorough assessment.
Welcome to the Derm Cafe. Here you will learn about the latest cutting-edge dermatology treatments and procedures from skin experts around the world. Now, on to today's Dermcast with your host, board-certified dermatologist and Mohs surgeon, Dr. David Harvey.
Hi, and welcome to this episode of the Derm Cafe. I'm your host, Dr. Dave Harvey. And in this episode 5, we're going to be focusing on skin cancer, how to detect it. You might be able to save a life. We've had, unfortunately, a lot of publicity about skin cancer recently with the passing of our well-esteemed and famous music icon, Jimmy Buffett, who died from Merkel Cell cancer. And he'd been suffering for about 3 to 4 years with this condition, and it's a more aggressive subtype. So, skin cancer awareness, I think, is very important. We'll talk about some of the statistics and dive into the non-melanoma versus the melanoma subtypes. So let's get started and dive right in. By the way, I don't know if it's cold where you guys are, but it's starting definitely to feel like fall. 44 degrees this morning in Atlanta. So I think we're into that crisp autumn time. So it's good to get your pumpkin spice lattes here at the cafe. All right. So in terms of skin cancer, I mentioned Jimmy Buffett, but there are other famous folks who passed from skin cancer. Bob Marley, he had what he thought was a splinter on his toe, saw a podiatrist, didn't think much of it. It continued to grow, was advised to have an amputation. He didn't want to do that. And he wound up passing for melanoma of the toe. So again, another famous icon. And then Burgess Meredith, I know for all of you baby boomers remember Batman with Adam West. He played the Penguin, and he was also Rocky Balboa's manager, Mickey, in all the Rocky films. But he passed of melanoma. And there have been some other folks like Randy Castillo, who was a drummer, and Maureen Reagan, the daughter of President Ronald Reagan. They died of squamous cell, and Maureen died of melanoma. Randy died of squam. So again, really important to be aware skin cancer can have, negative consequences, but if you detect it early, you can save a life. So we know that skin cancer, when pop up the slide, is the most common cancer in the US. About 1 in 5 Americans can expect to get this in their lifetime. And more than 2 folks will be expected to die of some form of skin cancer in the United States every hour. Interestingly, having 5 or more sunburns in your lifetime doubles your risk of getting malignant melanoma. And even tanning beds are negative influence on that. We'll talk about that in our second part of our segment. But the good news is that although it can hurt you, if you detect it early, 5-year survivals are very high, 99%, even for melanoma. So we want to kind of clue you into what to look for. Maybe check your spouse, your boyfriend, girlfriend, yourself. And if you're not sure, it's really important you see a board-certified dermatologist. So let's dive into the 2 subtypes of skin cancer. There's non-melanoma, which I'll focus on, and then melanoma. So let's hone in on the non-melanoma subtypes. So the non-melanoma subtypes preferentially occur in the top layer of the skin, and the most common one is basal cell carcinoma and squamous cell carcinoma. Basal cell carcinoma is the most common. It basically presents as a non-healing erosion or ulcer or acne pimple that might be bleeding. I show this picture here on the back. Here you see this ulceration. But you have to be wary of things that just aren't healing. I mean, if you put a cream on an erosion and it gets better in a month or something, don't worry about it. But if it's progressive, probably a good idea to get it checked out because you could be detecting an early skin cancer. Same thing with a pimple on the nose. If it's just not getting better, you've put different antibiotic topical creams or oral antibiotics, say your primary care, and it's still not getting better, get it checked. Again, about 3.6 million cases in the US every year, and it's easily treatable. Good news with this one, it doesn't invade like melanoma into organ systems like lymph nodes usually. So you can kind of cure these with creams or minor surgeries. Let's dive into squamous cell. Squamous cell is the second most common. And here I show a little pic of it on the ear. You see this ulcer that's just not healing and it's eroding into the cartilage. So these can be painful in this location. But again, similar to basal cell, usually locally invasive. These can be more aggressive if they occur on the lip or in the mouth. They can spread into lymph nodes there, especially for patients who've been smoking or maybe have had human papillomavirus in the mouth. So that does happen. So those are just some things to be aware of. But again, we treat this usually with surgery early on. It's curable. Detected early, it's curable. And again, non-healing, sore, similar to basal cell eroding, just not getting better. You want to get it checked out. Now, who's at risk for skin cancer? I mean, is everybody at risk? Potentially, yes. But the common folks that are usually fairer complected, have light eyes, have had multiple sunburns. And as you get older, we tend to get more skin cancers because our immune system isn't as good as fighting these cancers. So, age in and of itself can present more with carcinoma than when you're younger. There is an exception to that with melanoma, which I'll talk to you about a little bit later. Also, if you're immunosuppressed, maybe you went on some chemotherapies. Sometimes skin cancers can come from those, especially with some of the newer immunomodulators that we see with melanoma. But anybody who's immunosuppressed on immunosuppressive medications that might be for a transplant patient or somebody with cancer of a different organ system, you definitely want to be checked. But again, fair complected, light eyes, those are the main ones. We can also sometimes see skin cancer in burns. We can see it in traumas, even tattoos. So again, if you get a spot in your tattoo, it's raised up, welty, not getting better, starts to bleed, get it checked. There are other types of non-melanoma skin cancers like Jimmy Buffett's Merkel cell that I'll talk to you about now. These are rarer, but they should still be identifiable. So let's talk about these rarer subtypes. So Jimmy had a Merkel cell carcinoma, which derives from a cell in the top layer of the skin called the epidermis. And these can be very aggressive, sometimes even more aggressive than melanoma, because often when they're diagnosed, they've already gone to the lymph system. And usually that might be something like a cyst or a papule, and I'll show some pictures of that. And then there are other types of non-melanoma skin cancers that can be aggressive, like angiosarcoma. Those usually are like port wine stain type reddish plaques that occur on elderly folks usually, but not always. Head and neck, post breast cancer with radiation, patients can get it there. Sebaceous carcinoma, another one. Sebaceous is the oil glands in the skin. That's the cell type. But usually that'll present, for example, on the eyelid as a non-healing sty or just an erosion that's just not getting better. So again, you get a cream for the sty, it's not getting better. Probably good to see your board certified dermatologist. And then lastly, I'll mention one other one, dermatofibroma sarcoma, protuberance, big word there. We call it DFSP for short. But usually these are going to be on the trunk, can occur in skin of color, usually look like a keloid type of a lesion that's just slowly enlarging. These can be very invasive, very disfiguring and painful sometimes. I'm going to backtrack to the Merkel cell real quick because we talked about that. This is what I was talking about, the cystic-like look. They can be pale, they can be red, they can look like a little bit of a button on the skin as you see in that middle picture. And again, these are rare, but deadly. So if you get something that just doesn't look right, just get it assessed. It's probably a good idea. Again, it's rare. About 1 in 130,000 people in the US get it, but you can save a life if you detect these early. So on that note, we're going to go to break here. And when we come back, we'll be talking about malignant melanoma and tanning beds and kind of sort of wind things up for you. Thanks. Stay tuned. And we're back. Dr. Harvey back with episode 5, skin cancer detection. Hope you enjoyed your latte. And now we're going to talk a little bit more, shift gears towards the more common deadly cancer that people are always afraid of, malignant melanoma. So what about melanoma? I want to teach you guys what to look for with that and also describe some of the things you should be aware and some of the myths out there. Only about 1 in 5 melanomas occur in a pre-existing mole. But the point is, if you've had a mole all your life, potentially it could transform into a malignant melanoma. It's not common, but you can't just say it's been there and so it's okay. We don't always have to just have a blind eye. I think if things are looking suspicious or that mole starts to become irregularly pigmented, starts to bleed, starts to itch, or starts to grow tangentially on the skin, almost like spreading, I'll probably maybe get that assessed, have it biopsied. It won't hurt to do a little minor skin test. Most melanomas will occur as a new spot on new skin that just doesn't fit the pattern. We call that the ugly duckling mole. So you just want to be aware of those aspects. And here I depict a slide of malignant melanoma, you can see how it's kind of looks like the continent of Australia a little bit on the left, where Perth would be, it's darker brown. And then where Sydney and Melbourne are, it's a lighter brown. And in the middle, where you have the down under portion of Australia in the middle of it, it's more of a pink. But the irregular border, multiple colors, those are the things you look for. Again, famous people who died of this were Maureen Reagan and Bob Marley. Bob Marley, I mentioned, had melanoma on his nail. What would that look like? Here I show melanoma on the nail unit. You can see this broad pigment here. It has a little bit of a regular color, almost looks like the Saturn rings, but they're variable in their color. And if you look on the skin just above that, sometimes there'll be pigment on that too. That's called Hutchinson sign. But if you have a regular pigmented band on your nail that just develops, have your doctor or dermatologist look at it. It's really important. And when you come into the office for those dermatology exams, a lot of my patients wear beautiful nail polishes to cover those nails. Probably a good idea to take that off just so we can get a thorough assessment. In terms of detecting it on your body, though, again, we mentioned the irregularity. There is a ABC rule. We'll talk about that now. You learned the ABCDs when you were 5. You're going to learn them now. ABCDEs, actually. But A refers to an asymmetrical mole. So a symmetrical mole would be like a round oval or a circle. If you folded it on itself, it would match. B refers to border irregularity. C, multiple colors within a mole. We talk about sometimes the red, white, and blue sign. So if you have a mole that looks like the state of Florida, where Tampa is black and Miami is red and Jacksonville is like a off-white, and that irregular pattern, that'd probably be something to get checked out. D refers to the diameter greater than a pencil eraser or so. That's not as crucial because a lot of things are big. A lot of age spots and things can be bigger than that, but it's just another identifying piece. And then E, I think, is important, an evolving mole. To say you take a picture of a mole and a year later it's double the size with regular colors to it, that evolving quality to it wasn't stable, staying the same look. That's something that should clue you in, hey, maybe I should get this checked, even if it's been there since you were 5. So again, ABC. Now, why is it important to diagnose these early? Well, as I mentioned, you get these things early, you can cure cancer. Okay, if you wait too late, there's a greater chance it's going to go into the lymph system and cause havoc. So as you detect these things or not sure, tell your spouse, your boyfriend, girlfriend, mom, dad, sister, brother, get checked, especially on the back. You're not seeing your back. You're coming in for your acne visit, but maybe have somebody look at your back, or your dermatologist should look at that too. If we get it early and you did tell your brother to go in or sister and they've been checked and they detect the what we call the melanomas that are low grade, less invasive into the tissue, there's a 99% 5-year survival rate. So really good news on that end. And there's about 8,000 people that get melanoma in the US. Actually, there's trending down. I think we're getting better with the message. So at our last meeting in Florida, I just was in Hollywood, Florida a few weeks ago. We talked about that melanoma trend being a little bit stable or even getting less. Those are good reports. So hopefully, we're getting our message out and you're listening to these podcasts. By the way, if you like our podcast and you find these podcasts useful, like us on our YouTube channel, subscribe to our YouTube channel, The Derm Cafe, or like us on Instagram or Facebook. I just want to touch base here on tanning beds just briefly. Everybody asked about tanning beds being safer than the sun, and really that's not the case because whether it's indoors or outdoors, it's still ultraviolet radiation, and that could suppress the immune system, cause premature wrinkling, and also skin cancer. So my story earlier when I said, usually see this in the elderly, but I said there are exceptions with tanning beds and melanoma. A lot of times we'll get the story of, say, somebody going to their prom and they decide they want to do some tanning before the prom and they're 17 or 18, and then they're showing up with their melanomas in their mid-20s. That's what I'm trying to say. These cancers are not age specific all the time. So we want you not to use tanning beds, get sun tanning products off the counter, off the shelf. They're a lot better. If you have any questions about which ones, I think I have a previous podcast I talk about that. But I'm happy to answer any questions at drh@thedermcafe.com. But there are safer options than tanning beds. Plus, for anything else, you can get wrinkling earlier. So who wants wrinkles, right? So good idea not to use them. And then the other thing I always get with tanning beds is get that base tan, go to the, tanning bed before you go on your cruise. That's really going to be helpful. Really not. You don't get that much more protection. The best way to protect is UV clothing, hat, sunscreens SPF 30 or higher that say broad spectrum. And again, avoidance is a good one. So that's all I got for you guys today. Hope you enjoyed this podcast. Again, I'm Dr. Dave Harvey, your host here at the Derm Cafe, and I look forward to engaging you next time when we'll talk about actually how to treat some of these skin cancers. Thank you again for listening.
Thanks for listening to this episode of the Derm Cafe. We hope that you have learned some useful tips from today's Dermcast. Tune in next time as we explore another exciting healthy skin topic. Until then, be good to yourself and your skin.